Expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Aloha and welcome to Be Fit for Health. This is Bianca, your host. It's another great day to celebrate our health and wellness. And, it's another day of, opportunities and to look at things from a positive perspective. I will always start the show, always thinking about the good things in life. And we had a beautiful day today. It was sunny, and everywhere else in the country, it's cold. So we're lucky we live Hawaii, right? It doesn't get any better than this because we have the opportunity to heal our bodies every second of the day. You can go to the beach, dunk your body in that salt water and let it heal itself that way. Get some vitamin D, sunshine, just be with friends that are obviously social distancing. Keep that in mind. But, everything else is good, right? I mean, we have this opportunity to live the best life possible. And, this show today is going to be great because I'm bringing on someone who is pioneering a method of treatment that is, physician approved. And a lot of us, seek out a lot of therapy, whether it's massage therapy, you have, all the different techniques that comes with it. And there is a lot of different techniques out there. But I feel like now that we've progressed in medicine and now that we understand a bit more about the connective tissue and the way it functions with the muscles and the nerves and things like that, there's got to be an upgrade in the way that you do your manual manipulation when it comes to massage. And luckily, we have this gentleman here in Hawaii. He's originally from Germany, and he is someone who has decided to not only participate in giving us this type of therapy here one-on-one, but he also is willing to teach this to schools so that other students that want to become massage therapists can develop this technique. And it's very imperative that, we continue our education. If you are a licensed massage therapist, it's never too late to learn something new. And I know that Martin Giesselmann is a German-born physiotherapist who is, like I said, he's pioneering this revolutionary system called the Hoffa Manual Therapy. And he's trying to bring this not only to Hawaii, but he's willing to travel, I'm sure, to the mainland to teach other schools out there that are willing to learn and update themselves. His training is limited to massage. He does other things as well. And he has been trained to do other things as well. He's done hydrotherapy, electrotherapy, rehab, aquatics, exercise, rehab for orthopedic problems. He works with the connective tissue specifically, and that's what the Hoffa Manual Therapy, from what I understand, is gearing towards working with, is the connective adhesions and scar tissues, and the reason why he's on here is because I literally was directed to him by my neurologist, and she wanted me to get my medical massage done through Martin. And so I'm glad I did because, listen, I feel a bit better. I mean, it takes some time because you've lived in this body. Well, I've lived in this body for a very long time, done a lot of damage. It's not going to be overnight, but, with his help, I'm hoping that we'll get to a point where my body moves better. Martin, are you there?
Yes, I am.
Oh, fantastic. Welcome to the show. I'm so glad you were able, because I know you're busy, because I know you got a lot of clients, and I know I had to arrange this ahead of time to make sure you were available to speak, at least via phone interview. So I appreciate that. Thank you very much.
Thank you for having me.
So I know that I've had firsthand experience on what the Hoffa Manual Therapy is. And I know that your background is very extensive. You're also an athlete. I mean, you're not just someone that does, regular exercise, what have you. You're an extreme athlete. I mean, you've got championships for kickboxing in Europe, and you've done the Ironman, and you've done marathons and things like that. So you're someone who is an extreme athlete. So you know how the body can break down, and you know how the body needs certain rehabs and therapies. So give us a little background about who you are and what brought you here to Hawaii, and then give us a good detailed description of what the Hoffa Manual Therapy is.
Yeah, so I came 20 years to Hawaii because I wanted to live where it was warm. I did not want to live anymore. I want to live where at least pine trees grow. Yeah, so I'm very happy here in this environment. And the Hoffa Manual Therapy was developed by Dr. Hoffa, who also wrote the first book about massage therapy.
Oh,
And he developed this in the 19th century in the oldest medicine school in Germany, in Würzburg. And he worked with another important doctor together, Dr. Röntgen. You never heard his name, but he invented the X-ray.
oh, wow.
So in Europe, we say get a Röntgen done. We don't get an X-ray done.
Got it.
So these two work together, and Dr. Hoffa developed that out of a normal Swedish massage and called it a three-finger pit massage because the technique is only done with 3 fingers. It's absolutely pressureless, so I don't use any vertical pressure.
Oh, you don't do any pressure. I got it.
Yes. Therefore, I can treat 90-year-old people with brittle bones and osteoporosis, or little babies, or pregnant women till they give birth. So that's all possible, and it founded on the effectivity that connective tissue is where the pain is. All our soft tissue is where the pain is. Bones usually don't hurt.
Right.
So, and he was able to isolate nerve adhesions, what's called nodules. This is when a pain signal goes through the nerve will swell up, sometimes very far away from the source. So you can have ankle pain, which comes from your sciatic nerve.
Yes.
And then you have connective tissue adhesions in your fascia, which can individually squeeze on the nerve.
Yes.
And you have muscle hardening due to constant contraction when we do repetitive movement syndromes. And all these 3 symptoms are to discover in the soft tissue. And it's literally like combing hair. When your hair is tangled up, you cannot pull on it or push on it. You have to find where it's tangled up and untangle it.
Right.
And that's literally the Hoffa Manual Therapy.
So you're saying the 3-finger technique, because I used to be a licensed massage therapist, and you know this.
Yeah.
So, we were taught trigger point therapy, which was the applying a certain pressure to a certain amount of time to relieve the Golgi tendon from that area to relax that knotted up muscle. Now you're saying that doesn't work because that is a knot that may not be able to be removed depending on the type of knot it is, correct?
Yeah. Yeah. When you push on a certain pressure point, the adhesions in your connective tissue is still there. Or the muscle hardening, you might have some success, but you will not also be able to remove a nerve nodule, which is the swelling on your nerve tissue on the myelin fascia wrapped around the nerve. And all these symptoms don't show up on any MRI or X-ray.
Right.
They are only to palpate. And Dr. Hoffa, for example, said a doctor who cannot palpate cannot diagnose. Today, we have the problem that no doctor is ever touching you when you go with your parent to a doctor. They only say, can you do this? Can you do that? But they don't touch you. And that's the biggest problem we face right now.
No, it's a big deal. I mean, because we're losing that. What do you call it? It's a different type of a medicine, right? You're missing out on that one area of medicine where it gives you the opportunity to see abnormalities through the touch.
Yes, absolutely. And that's what I treat here since over 20 years in Hawaii. All the clients I have had one thing in common. No doctor ever touched them. When you have knee pain, you send you to an X-ray and the MRI, but they don't touch your knee.
Yeah, X-rays don't show your pain. They might be able to show if you have arthritis, there are some missing, the muscle, if it's solid, the color, if it's dark, it means your muscle abilities are good there. But if you got white spots, it shows that there is deterioration of the muscle. That kind of a knowledge base in X-rays or CAT scans or whatever it can be seen, because I was able to do that in Santa Barbara. But when it comes to seeing knots or seeing any inflammatory response in the muscle tissue, you really won't see it unless you have a muscle tear.
Yeah.
So it's kind of difficult to treat, like you said, unless you repalpate. I mean, how else can you, so tell me, when it comes to doing this type of treatment, now my neurologist sent me to you. I thought that was really interesting because not too many people understand that the fascia holds a lot of pain receptors. There's a lot of information to be had in the connective tissue because it's everywhere in your body. It's connected to everything. So if you had pain in your body, most likely it's coming from the fascial connection. Explain to us why that is, though, and why not the muscle tissue itself?
Well, yeah, it's all in your soft tissue. The three things like the connective tissue, the fascia, we have the muscle tissue, and we have the nerve tissue. And they all are related to each other. When you have a hypertone muscle, he gets not really circulated, then your fascia will get adhesive and sticks together. And then your nerve tissue doesn't give the right signal to your muscle, then your muscle will swell up and does not have the right contraction anymore, or stays hypercontracted. So Dr. Hoffa found the reflex sensor, a stretching sensor in your connective tissue. When that is stretched, when that is triggered by my massage technique, then the stretching sensor will send a message to your central nerve system to relax the muscle. That's what the principle of the petrissage is. The lifting, ringing, rolling gives this message to your central nerve system to relax the muscle and increases the circulation on that spot.
So what's happening when you're doing trigger point and you're doing a vertical pressure? What's that message happening?
You probably will extract histamine and acetylcholine. Acetylcholine, that's pronounced here.
Yes, you got it right.
Yes, we call it acetylcholine. Acetylcholine, and that will bring a short increase of circulation and might get a short impact on the tissue there and relieve some pain, but the connective tissue surrounding will not be relieved.
So the only way to do that is through the pulling and the rolling and the pushing along? Is that
correct.
Right?
So literally combing the tissue around it. Because when everything gets tight, for example, in frozen shoulder syndrome, your whole arm will be pulled into your socket, and then there's no more movement possible. And the newest fascia research also underlines that your pain will always be in your soft tissue. And our connective tissue is the main connection, what holds us together and even upright.
So if someone who has an injury because of the adhesions built up from the accident or a fall or what have you, you're saying that cause can be a domino effect of a chronic if it's not treated properly. And so we're thinking like massage and physical therapy is enough to get the muscle going. But you're saying that repetitive physical movement can cause more of a tangled up hair type of thing, you're saying, with the muscles for the knots.
Yeah, sure. Any impact can do that, any injury, or even after surgery, even a surgery, every pain syndrome will constrict your muscles and your connective tissue and even nerves. And strengthening training, what's normal is done when you have any pain syndrome, will only develop other muscle groups because your body will always help you. We have to reconstruct the functioning of your muscles first before you can strengthening it. And that's done
So you're saying that physical therapy is not a good idea to do after an injury? You're saying that maybe this person should be seeking more like a soft tissue manipulation first before they physically exercise?
Yes, which should be also normal physical therapy here, or very often is only done with strengthening training and not with hands-on. And to prepare the muscle to react on strengthening training, that should be the first step, yes.
Well, that makes sense to me because working out with a tight muscle, you can't expect to get full range of motion. If you have a tight muscle, if you have a tight chest muscle and you're doing bench pressing, you're basically working at a limited range of motion. So, that's why... Go ahead.
every contraction of your muscle is a shortening of your muscle. And if your muscle is already short and you make him more contract, he will try to help you and get stronger, but he won't get longer. He will get really, really stay tight, and that doesn't work. So we have to really, yeah.
I was going to say, does it make sense then foam rolling? The foam rolling idea, or as my friend has a business called The Fascinator, he's working with in Germany, he's working with, God, I forgot his name. I can't believe I forgot his name. It's the tip of my tongue, but he's a part of a fascia plantation group. And basically he's saying the Fascinator helps people who have pain, chronic pain, get better with time of doing the foam rolling type of techniques or fascinating techniques.
You will increase circulation, which is a good thing, and the increase of circulation can bring some relief. But the adhesions you have, it is like I always tell people, you cannot comb your hair with a foam roller.
No,
so whatever
looks so pretty.
Is tangled, whatever is tangled up in your tissue will stay tangled up. So if you roll over it, you increase circulation, which is always a good thing. But the adhesions, what led to this pain, will stay there.
Isn't that interesting? And with the way that we are taught to take care of our body system, is that you physically work out to get the body to be strong and be balanced again. But with what you're saying, because of the fact that makes sense to me, because I'm coming from both perspectives, trainer and a massage therapist. If you have tight muscles, movement, even stretching, I would say you need to be cautious with, correct? Because if you're stretching on a tight muscle, you're going to be causing more adhesions or maybe scar tissue because you're tearing things up.
Yeah, your muscle will hold against it. So you fight your own muscle. And it's the same example. You cannot comb your hair by pulling on it. Whatever is tangled up, you have to find where it's tangled up and untangle it.
Yeah, that's crazy. So when was this method created again? How long ago?
In the 19th century.
Wow.
That's when Dr. Hoffa also wrote the first book about the massage. And working with Dr. Röntgen together, he had access to X-ray, and they called the medicine school the cradle of modern medicine, because they developed there the first plaster cast for broken bones, and also the clamping method, which is still used today in operations. Without it, they did not know at that time, when they cut into someone, he would bleed to death. They did not know how to deal with arterial blood flow. So today the clamping method is used, and that was developed in the same medicine school.
Wow, that's pretty impressive. I mean, that's exciting to me because, to know that there is a technique. God, I wish they taught this to us in massage school. I mean, not to take it away from the schools here in Hawaii, but why haven't they taught us acupressure, which is, working with the meridians, but, they don't teach us the 3-finger technique, which I may have experienced once in a Chinese medicine chiropractic environment a long time ago. And I remember thinking, God, this is a weird massage. Like, how is this going to work? But now that I've met you, it's making me realize that was something that was needed more so in a more universal perspective to get the fascia. Now that we know more about the fascia today, for it to balance out, because right now we're still learning about the fascial system.
Yeah, and the beauty and the effectiveness of the Hoffa method is that you treat in one treatment muscle tissue, nerve tissue, and connective tissue all together in one stride, and that's the biggest difference to all of that.
So, can you treat patients that have other conditions besides muscular fascial? Like, how are you able to treat people who have, like a heart condition or cardiac issues? Because I remember seeing that in one of your documentations.
Well, Sure, I cannot give any heart problems whenever there's a dysfunction of the heart. We only can use the increase of circulation, which has to be done carefully when there is a heart condition, because you might have also experienced it, what a deep impact the massage technique can have
Hmm.
You get literally a natural high from it. There is lots of noradrenaline extradited, and there is a strong impact on your whole body. Open heart surgery, for example, has a big scar tissue, which restrict by lots of clients
Mm.
the breathing after the treatment.
Mm.
This can be very, very effective treated, and I've done it several times to get the scar tissue loosened up, to get deep scar tissue, even in colon scar tissue in colon from cancer clients I've treated with success.
Oh yeah.
Yeah, that,
Let's not talk about that. That's a little awkward.
no, I was literally invited to treat in the Queen's Hospital by that, but I
Oh,
couldn't at that time because I was employed and my boss said we are not insured for that. But
yeah.
I was invited because I was able to do that.
Interesting.
And there is a deep impact. People with heart conditions can be still treated. I cannot remove the problems they have, but I can definitely treat them mostly due to fear. When you have heart conditions, you have also a very, very constricted connective tissue.
Well, that makes sense, especially if they did have open heart surgery. There's areas that cut is also scar tissue and adhesions, and I could
Absolutely,
imagine that would
absolutely.
restrict their rib
Yeah,
cage from properly going in
yeah,
and out for breathing. That makes sense to me.
yeah,
But there's also in the back
absolutely.
where you worked on me, where and I've said this before, the central nervous system and the spine, each part has a connection to a body's organ. Like for example, T6 is connected to, T3 or T2 is connected to the heart. So if you're trying to manipulate neurologically the heart area, that part of the spine is restricted and it's tight and the muscles aren't giving, you know, even if you went to a chiropractor, that area is still restricted. So doing a manipulation of loosening that up enough for the vertebrae to have a breathing room for the nerves to do its job with that specific organ makes sense as well.
Absolutely, absolutely, and that goes for the liver, gallbladder, constipation. That is all very, very treatable with that technique.
Yeah, it's really
And
interesting stuff.
I often feel nerve adhesions, and when I ask the client, does he have any gallbladder problems, and then they must sometimes even say, I don't have a gallbladder anymore. Then still the nerve restrictions are still palpable on the back.
Interesting. Yeah, isn't it amazing how you can get connected to different parts, body parts, without having to really go in and do surgery? I mean, that you can actually manipulate communication in such a way so that the body responds properly. It's giving the body the right information so that it does what it's supposed to do, which is basically ultimately your job, right?
Yes, sure. And that it has a very, very strong impact on your so-called autonomic nerve system, what controls your breathing and your digest system, your heart your blood pressure, your heart rhythm. All that is to treat with that method, and it has a strong impact on it.
Have you worked on cancer patients with this as well?
Yes, and but that is always discussable. The cancer treatment has to be in remission because due to the strong increase of circulation, it is possible to spread the cancer even more. So that has to be physician approved if the cancer is in remission, and then it is possible. Yes.
Yeah, that does make sense that you would promote any type of circulatory response would promote whether it's a positive or negative. You've got to
Yes.
make sure the toxins in the
Yes.
system are able to filtrate itself out. Um,
Yes.
and that's the issue with a lot of people is that we don't know how much toxic load we have in our body. We don't know. I mean, I may ask specific questions as a trainer and wanting to understand someone's dietary habits. Do you eliminate properly? Because if you don't, there's that toxic buildup. Do you work with chemicals? That's another toxic buildup. Are you eating processed foods? That's another toxic buildup. There's all these different things that can build up toxins in your system. So if you're massaging someone in this particular method, and you're releasing all this toxin in from the tissues that's been sitting there stagnant for a long, long time. I can imagine that there's some side effects, correct?
Yes.
So what do you recommend
Yes,
for people to do?
Yeah, their own circulation has to be working out, sweating, sauna, for example, everything what sweat and increase your circulation to get the toxin out of your body. Hot and cold water therapy, for example, is very important, which is
Okay.
used almost in all over Asia and also in Europe a lot with the sauna, the hot and then the cold water reaction to it. So whole food, healthy food, stay away from anything what increases your acid level. So acidity and due to soft drinks and all that has to be controlled and shouldn't be put on top of your problem.
Got it. Well, that's kind of a given, but a lot of people may not realize that that's an important factor as well. So I'm gonna put you on hold for like 15 seconds because I'm gonna do a commercial break, and then when we come back, I want to get a little bit more into the functionality of the method and how how you can do different things for athletes versus people who don't move much. And I'm sure it's the same for all people, but I'm sure you get a different response from different people. So hold on tight, so don't go anywhere. We'll take a quick break.
You don't need to be a member of a gym to get your health and fitness back on track. Be Fit for You with a Be Fit for Health online personal training and nutrition program.
Well, that was quick. We're back. We're back with our physiotherapist, Martin Giesselmann. He is from Germany, but he lives in Hawaii for the past 20 years, and he does this technique, which is pretty amazing. It's a 3-finger manipulation called the Hoffa Manual Therapy, and he is also a licensed massage therapist here, and he's been treating people for a while, but I know him through my neurologist, and she referred me to him, and I'm glad she did, because the weird story behind us too, though, Martin, is that I know your girlfriend, and it's so funny because when I met her, she said, you need to see my boyfriend. He does some amazing body work. I'm like, yeah, that's great. I'd love to meet him. And then what? A year later, by chance, I get referred to you by the number 2 person that wants to refer me to you. So it was meant to be for us to get together here. That's crazy.
Yeah.
I know. Isn't that weird how the universe works?
Yes, it does. And I worked with these neurologists since over 15 years together, and she sent lots of clients to me. And we had always a great success, especially for headache clients.
Oh, yeah.
And yeah, that was, she has a lot of clients who got better soon here.
Well, I know that there are different types of people that you work on, and I know there's some people that are absolutely chronic and they're critical because they had an injury that may have put them out for a while. But there must be different responses from people who, unless they have an athletic system or always had an athletic system, but they haven't worked out for a year because of an injury, versus someone who's never really worked out but doesn't have a severe injury, but still comes to you. But the response of both people are different based on their conditioning. So tell me how that works.
Absolutely. So the Hoffa method uses the receptors, the stretching sensors in your muscle, and that the relaxation has a strong impact and has the same chemical reaction on your muscle like you would do a workout. And it's measurable up to 4 hours after the treatment. That's why everybody in different strengths, but everybody will have the next day some sore muscles. Like it feels like a workout pain. Right. And then it is problematic for me to explain to someone who never works out. It feels like a workout pain. What are you saying then? And said it feels like you get a flu. So there is some. That's the only explanation.
That's not a very good advertisement for your business, by the way. I would say no. I wouldn't say that.
No. It feels like the first muscle ache you have when nobody ever had a muscle ache from working out. Then you have to find some kind of example. And the reaction, if someone works out, sometimes they have a stronger reaction because their muscle is easier to react. It's easier to get a reaction from. But when people never worked out and their connective tissue is so hard that I have a hard time to even get a grip on it, they will have a strong reaction in their toxic sense that because a lot of toxic will be extruded. But the muscle reaction on the muscle is always the same if someone is trained or not trained. But the severity of the next day, that will be the biggest difference.
Right. No, and you're dealing with my body, which is great that I had this experience with you. I think we've had 3 treatments or so, and so it's different every time for me because I guess it depends on what's happening neurologically with my body. So you are getting a quicker response as we go. Because every time you touch my back, it seems to respond quicker and quicker. But it's like my body is a little more different. We don't know what we're going to expect depending on the neurological system. So the nervous system is very unpredictable in a type of person like me. Even though muscularly it's got the history of working out and having conditioned and things like that. So the brain and the body connection is there. I just don't know how else to describe it except for the fact that, how do you deal with patients who have an unstable nervous system or overreactive system?
Man, there's some loud noise here. But,
okay.
It is possible to deal with almost any condition, like so-called fibromyalgia. I just have to adjust my own strengths, how to approach that ground, and that comes with all these years of experience to gauge my impact on the person, and it depends on the diagnosis and on the pain that the client has. But the technique and the technique will be always the same. The intensity, that's the difference.
And maybe the duration as well, as you were saying the last time.
Correct. Duration, and that's what comes with the intensity. Yeah, duration and intensity is definitely the difference. What is to make.
What's really cool too is that if someone has, let's say, a neck injury and you can't touch them, obviously, because they get dizzy or nauseous or what have you, because of the nervous system being so reactive, you could probably get into other parts of the body, like you were saying to me earlier in one of our sessions that, I have a vagal cranial nervous system issue because of the fact that there is some really tight muscles into the spinal area, so that you're trying to get that to loosen up. And before you could do that, you had to work, let's say, on my lower back or, my lats or things like that in order for that whole system to kind of loosen up enough for you to actually go in and do your business up there.
Yeah, often I often go away from the initial pain where the pain is and where the client feels the pain. I go to different spots, either above or higher from the same muscle group or wherever there is a connection, even also in the connective tissue, that this has to be loosened up. It always goes from the connective tissue to the muscle tissue.
I remember thinking that with massage, though. I remember one of our professors telling us that if you have a headache, sometimes starting from the calves is a good point because it all works up. It works its way up and down, right?
Yes, sure.
So the way you stand, the way you walk, the way that your hips have to rotate, and then the way your spine gets affected from the hips, and then it goes all the way up to your neck, which can then cause.
Absolutely.
Yeah. So you were working on my legs the other day. That's why I remembered that.
Yeah, my first reaction is always to see the client if there's an even leg length. Is one hip higher than the other? Is one shoulder higher than the other? So my introduction starts literally when the client works towards me, and the first handshake, that's already an evaluation for me.
Right.
And the evaluation is the biggest part of that. And then you have to literally constantly keep an eye on the reaction when I touch here. Does the client makes a fist or whatever? Because the main part in my technique is always the client always should be relaxed. If he starts fighting you because you cause pain, that's not what I want. Then I have to reduce my impact and go to different area first, or lessen my intensity.
But you're trying to
So
re-educate the brain, right? You're trying to create this neural
yeah,
pathway that's renewed neural pathways to the system, so your body doesn't feel like it has to constantly tighten up.
and also important that the client who has pain, he's usually scared that when I touch him and there is more pain, that it will get worse. So I have to build up trust in me that I can feel his pain and or her pain, and that the main part is that the client should feel kind of I call it positive pain, a pain where you feel, oh, it hurts, but it feels good at the same time.
Right.
And in that intensity, I like to work. That's because when the client cramps up somewhere, that's not what is wanted.
Sometimes it's a surprise, though, Martin, that when you go into a spot that I'm not expecting to have any like pinchy type feeling, it's like, and then I go, ooh, and you're like, was that too much? I'm like, no, I'll be okay, because it's your body's not used to maybe that spot being touched or manipulated. You know what I mean? Because you're always, when you do massage or you're palpating your shoulders, your body has a certain understanding that's where to go for pain, comfort. Like when you massage it, it rarely has this understanding that you're going to touch the bottom part of my rib, or my bottom part of my scapula, of my shoulder blade area. Because not too many palpations or any type of therapies usually work there. So you're trying to get to every aspect of the rib, back area, so that you're loosening up all of the adhesions that might be causing a stickiness from the muscle to the skin.
Yeah. The principle literally is nothing what I do should hurt. Whatever hurts, there's something wrong. And that means I should work there till it doesn't hurt anymore.
Right.
So,
I know, it's crazy.
Yeah. Any resistance in your tissue, I feel. And then I have to analyze if it's muscular, if it's nerval, or is it fascia tissue. And then I have to work on that till it's gone, till it's very, very soft. Because literally nothing what I do should hurt. In the beginning, almost everything hurts. It depends on the condition the client is in. But yeah, in the beginning they think, oh my God, that hurts, and I will never get better.
Well,
and then I have to gain trust that I
right.
tell the client, I feel where you have the pain, and that's why I work there. And once that is established, then everything is fine.
I know I've asked you this, but I'm sure the audience is probably thinking about this. Like, how long does it usually take before someone actually gets to a place where their body is functioning somewhat normally, to a point where the pain isn't constant, where they may get it once in a while, but not all the time like they were before? How does that work?
Well, that depends clearly on the condition of the client, on the circulation, on the endurance of their problem, if they had it for a long, long time. But I had literally conditions, and it is hard to say. I have to treat 1 to 2 times to see how the reactions on a client is. There are cases where I had 15 years of pain resolved in 1 treatment. It's possible. But that's not generally to say. So I have to see what is the condition. I cannot give you bones back when you have a big arthritis, for example.
Right.
But even that doesn't mean you have to be constant pain, or a bulging disc I cannot remove, but
Right.
I can definitely get the client pain-free for a certain amount of time till they might have, with an unlucky movement, hit the bulging disc again, and then they're cramped up for a while again. But certain conditions I cannot constantly remove, but I can definitely make them all feel better for a certain amount of time. I have clients, they come once a month or half a year. Anything is possible there. And it is hard to say when you come with the adhesive capsulitis or frozen shoulder syndrome, how long it will take. Everybody is a little bit different in their reaction, but it can be resolved. That's for sure.
So the Hoffa Manual Therapy's goal is to basically remove the scar tissue buildup or adhesions for your muscles to be able to move and have less pain in that area. So if that's the case, I mean, that's good. But like you said, what if your body makes scar tissues? Like, what if your body naturally is prone to developing scar tissues? How do you deal with that? Those people you can't help. Yeah.
Yeah, well, normally, yes, you can get them for a certain amount of time pain free till it comes back. You can in that kind of case, you can literally slow down the development of scar tissue. I don't cause injury that it develops more scar tissue, but
Yeah.
when that condition is there, I can definitely get it for a while pain free, and they have to maintain them and come back from time to time.
Yeah, I
But
would think so. Because I would think
yeah,
athletes like yourself, like Ironman athletes or marathon runners, they must have such intense scar tissue or adhesions in their body because of the constant pounding of the system.
no, not necessary. Endurance sports, they do have often a very, very good reaction because the circulation is established. And scar tissue literally mostly from develops injury mostly or constant impact if you do repetitive movement. But the my target and also Hoffa's target was to get the refunctioning and the functioning of your muscles and tissue, and then do the right and educate the client, then do the right amount of exercising and stretching and strengthening to stay that way.
Interesting.
So my target normally is to never see my client again with the same pain.
Right. Because there's always something. The body will always create something, I swear.
Yeah, sure.
So I would say that, with all of this being said and done, that I'm surprised that is there any current type of updates on the Hoffa Manual Therapy? Is there any type of like new publications or new articles written about this methodology on how it works in the body? I mean, besides what we've discovered almost 100 years ago?
I have a pretty detailed book, but that's sadly it's in German.
Well,
And
that's not going to help
actually,
us or the public. Yeah.
No. I actually, well, the charge and what they did, that is easy to translate. The whole book is a little bit harder. I try to do that, but it's a little bit hard. And there's only one school in Europe, and that's where I went in Germany, in middle of Germany, where you can learn that method. Due to the intensity and the length to learn that method, it's pretty hard to follow up. Lots of therapists who go there and see the effectivity, they often stop using it because it's pretty intensive on physically.
Oh, on the therapist?
Yes, on the therapist, because it if you don't do the right positioning, you saw that how straight I am.
Yeah.
You don't bend over. I don't use vertical pressure. That's all very, very important. But on your hands, you do work.
Right,
You
I would think.
constantly contract and decontract, and it takes some self-care. But I'm doing this since over 30 years now, and I have no problem with that.
I would think you would have to work or strengthen your forearm muscles so that the tendons don't overwork itself to a level where it doesn't have that support. So your forearms and your shoulder muscles.
Yeah, but the strengthening happening by doing it.
Yeah. Well, those fingers constantly moving, that's high repetition. How do you do therapy on your fingers?
Well,
You have to.
Well, the thing is, you have to learn to decontract. So for me, a contraction, a constant contraction, if I would hold my hand in one position, then I would get hurt. But our muscles are made for contraction and decontraction. So I constantly decontract in seconds. I constantly contract and decontract, contact and decontract. And then I have no problem with that. And the conditioning of your muscles happens by doing it. So, but the importance is that you are really feeling that you decontract. And that my sport helped me with that, especially martial arts.
Yeah.
You cannot punch when you contract it, so you have to decontract first, and then you contract and decontract again, and that's exactly the same way I work.
Well, that's why you're a champion. you knew what you were doing exactly, and I find it interesting that you, as an athlete, got into this type of treatment therapy instead of going to school to be like a chiropractor or a physical therapist. I mean, a physiotherapist. Basically, what does a physiotherapist do? What is the difference between massage, physical therapist, chiropractor? What does a physiotherapist do? What's your main goal?
It's the main goal is to get the client pain free and give them the knowledge how to stay pain free by doing a better lifestyle, whatever led to that. If it's an impact due to an injury or a car accident, then it's different. But all our repetitive movement problems we have sitting on a computer, and we have to educate during the treatment. I will and educate the client how to act that it doesn't come back, and that's the main goal of the whole thing, to give education to the client. And the physiotherapist is educated in electrotherapy, water therapy, balneotherapy, which means plant therapy. I have knowledge also on what plant to use, and balneotherapy, that's bath therapy, like herbal bath to relax. Physical therapy with movement and strengthening training.
Wow, that's crazy.
It's all part of the whole education, and it takes about 3.5 years. What we do, and we work in hospitals and literally get clients like knee replacement, hip replacement, and you get 4 clients per cycle, and you are responsible for them to get them out of the hospital pain-free as soon as possible.
Wow, that's amazing.
And you do everything to them what is necessary to get them pain-free and functioning.
Well, I see why you're doing this treatment now. It's actually less overhead. I mean, you go to people's locations. You don't have a clinic, do you, Martin? You don't have a place where people can come to you?
Right now, when the COVID started, I was forced to out of the clinic, and I was happy that I did not have any overhead for that. And it will possible. I have lots of offers where people wanted to work with me, but right now I'm pretty happy with what I do.
No, that's great.
I travel to clients, and most people have their own table. And I treat whole families and in one spot, so that's often the case.
So you're very COVID aware. So you're very safe.
Absolutely. I treat very selective. I treat often clients who are literally also very selective in their lifestyle. They often bubbled up and don't go outside and only see certain family members. Yes, I
Yeah, well, you have to stay healthy for you to continue working. Unfortunately, there's a lot of people who aren't, and in clinics and a lot of telehealth type of medicine is being done now, where you don't even get to see your doctor's face, or don't even go into the office. So this is good. I mean, this is great. You're bringing treatment to people's homes where they're more comfortable, where they don't have to go somewhere and take the risk if they don't want to take a risk. They have everything set up the way they want it to have it set up, so it's safe for them, which is great. I think, if anything, if I got out of this is that, there's always something out there that we don't know about that could help us improve. And I'm always excited to find new treatments or therapies that can take me to the next level or to the next step of health. And I think your business and what you do with the Hoffa treatment is definitely unique. I was going to say, just a really quickly brief, because we're running close to finishing up. Your treatment is very different from Rolfing. Yes?
Yes. Rolfing is the method what comes the closest to what I do.
Yeah.
They go over the connective tissue, but they often don't treat the muscle or the nerve tissue underneath, and that's the biggest difference.
Yeah.
They definitely come from the right idea. Either Rolf had the right idea that the connective tissue is the biggest factor in our pain problems.
Right. And it's actually more painful to administer or to receive, so to speak. So I've had it.
That's the next step that I am very, very aware that the client, that's why I said it, should be able to still relax while I treat him.
Yeah. It's not a relaxing thing.
I don't want to cause that much pain that the client is not able to relax.
No, you're definitely welcomed versus someone else who does rolfing. Trust me, I know you know, but I wanted people to know the difference because people say, oh, I want to go get rolf because of my connective tissue. This is another option, everyone, that you can get treated as far as your fascial system, if that's your concern. But for someone like me who has a neurological disorder where it's overly excitatory, I know that my fascia is a culprit to this issue, but it's also, unbalanced muscles, and it's allowing the muscle to move for range of motion so that I can actually do proper stretching or proper movement and then maybe get my muscle strength back because now I'm able to move the muscle. So, Martin, this is really exciting and I appreciate you coming on to explain to us what you do. What's a great way for people to contact you if they want to set up an appointment with you?
Well, the best thing, go to my website. There's also my email and my phone number on there where they can contact me, text me, call me, or write an email, and I will get in contact with them.
And
they can read.
What's your website?
Martin, mghealinghoffa.com.
So MG Healing.
Healing. And then Hoffa, Hoffa, Dr. Hoffa.
Okay. So mghealinghoffa.com.
Correct. And
okay.
There are lots of reviews, lots of even clients who wrote down their experiences, and lots of doctors who had an impact on my and knew what I could do to their clients here.
Well, hopefully some schools hopefully if someone from one of these massage schools are listening, they can also reach out to you and have you be a part of their educational system, because I know that you could teach some of these guys how to do what you're doing. And that would be great to have more of you. Well, maybe not because you're 30 years experience versus a brand new person, but still have more options out there for people to utilize. So hopefully they'll reach out to you too.
That would be wonderful. Yes.
Yes. Well, Martin, go ahead.
Yeah.
Go ahead, please.
Yeah, that's the biggest thing, that we have to get more and more medical trained massage therapists on the street, because the spa massage is everywhere, and if you want to make a difference in that, then you should definitely go to and learn a clinical and medical massage therapy.
Yeah, I agree. I think that's the best way to go. I was a medical massage therapist. Unfortunately, I didn't have your technique down. I wish I did. That would have been much more useful, and maybe I would have lasted more than 15 years of doing it license-wise. But so thank you, Martin. We're gonna have to say goodbye to you for now, but I appreciate you. I thank you for coming on and educating my audience. You're awesome, and I look forward to seeing you next week to get my treatment.
Thank you for having me. It was great fun. And yes, I'm looking forward to treat you too.
Sounds good. Okay, Martin. Have a great rest of your day.
Thank you. You too.
Aloha. So everyone, thank you so much for tuning in today. I know it was a different type of a show, and I hope you learned something about the Hoffa therapy treatments through Martin. And I know that you will get an opportunity to get treated. I hope you will have as good of a time as I do when I get treated, because it always feels good, right? All right, you guys, I just want to wish you all the best. Take care of yourselves. Make sure you have a great rest of your day. Be well, be healthy, and aloha.